Hello everyone, this is me Sradha, a psychologist, and let me talk about something that happened to me and my team recently. Now, there are a lot of sessions that are planned every day, and we generally take bookings up to like 2 weeks. And for me, as well as for Ayush and for our other therapists on the panel, now, we have a policy for cancellation and refund, which is stated very clearly even before you book a session, even before you book any session with us. And definitely, every therapist has their own way of doing it. There is no specific guideline that any therapist has to follow. There's no standardization practice as per se. However, the basic norm of any therapist or appointment is that if it is last minute, then do expect the therapist to charge you either a cancellation fee or maybe a no show fee. That is basically you have missed the session and they have to charge you for the slot, for the session, for the time that they have been waiting for you. Now, we have certain policies that allows patients to reschedule their sessions a few hours before their session is scheduled. But if there is no contact, no communication, no interaction between you and the organization and the team, then definitely we wouldn't be responsible or we wouldn't be able to help you out with your concern or your problem of having a rescheduling issue. बट बहुत हद तक लोग इस चीज़ को नहीं समझ पाते हैं क्योंकि हम एक हेल्पिंग प्रोफेशन में है, एक सर्विस प्रोफेशन में है, लोग हमारे पास डिस्ट्रेस में आते हैं। बट आपको मैं ये कहना चाहती हूँ एज़ अ थेरेपिस्ट हमारे पास हर वो पेशेंट जो आता है वो डिस्ट्रेस में आता है। हमारे पास हर वो क्लाइंट जो आता है वो डिस्ट्रेस में ही आता है क्योंकि हमारा प्रोफेशन ही ये चीज़ है। हमारा एम्पैथी देने का कोई कमी नहीं होती है, हमारे में कोई ऐसे कठोरता नहीं है कि वी डोंट अंडरस्टैंड दैट इट इज़ हाउ हाउ problematic or how troubling it is for you to lose that amount that you have paid for booking the session. We do understand that, and that is the respect that we provide to you, that we are available when we have committed to you. हमारी कमिटमेंट हमेशा आपको हेल्प करने के लिए रहेगी, हमारी कमिटमेंट हमेशा आपकी सेशन के लिए अवेलेबल होने के लिए, जो चीज़, जो टाइम, जो वे हमने आपको प्रॉमिस किया है, जो हमारी तरफ से एंड ऑफ द डील है, तो डेफ़िनेटली हमारी जो कोशिश रहती है वो कमिटमेंट को पूरा करने के लिए रहती है। बट अगर आप अपने एंड ऑफ द डील, आप अपनी रिस्पॉन्सिबिलिटीज़ एज़ अ क्लाइंट नहीं निभा सकते हो, तो डेफ़िनेटली we can't push it on the therapist. There are many therapists who face this issue, and as a supervisor to many of them, I also advise them to keep your terms very clear and transparent regarding your cancellation policies, regarding your rescheduling policies from the day one itself. And बहुत सारे लोग ये एडजस्टमेंट कर लेते हैं कि कोई बात नहीं, वी आर इनिशियली स्टार्टिंग ऑफ एंड डेफिनेटली अभी मेरे पास टाइम है। एज इनिशियल साइकोलॉजिस्ट, एज न्यू कमर्स टू दिस फील्ड, आई वुड टेल यू दैट आप अपनी प्रोफेशनलिज्म डे वन से आप लेके चलिए। आप अगर अपनी प्रोफेशनलिज्म डे वन से नहीं लेके चलोगे तो एज अ थेरेपिस्ट आप एक प्रॉपर एनवायरनमेंट सेट नहीं कर रहे हो क्लाइंट के ग्रोथ के लिए। यू आर अलाउइंग देम टू take this information and take this understanding from your action that your boundaries don't mean anything and they are not going to respect that. But therapy is essentially a process of learning how to respect boundaries, how to work within boundaries, how to understand each other and develop those interpersonal relationships within set boundaries. And ये skill अगर हम therapy में अपने patient को नहीं सिखा सकते हैं कि how they can respect you in the process of therapy, then definitely your patients are not going to be able to be assertive, are not going to be able to be respectful for the boundaries of other people in their life. And when they're going to go out, they are going to expect the special treatment, the entitlement, and that is majorly the problem with a lot of people. एंड ज़्यादातर ऐसे लोगों को ही दिक्कत होती है जिनको बाउंड्री इश्यूज होती है, जो रेस्पेक्ट नहीं करते हैं दूसरे के टाइम को, जो रेस्पेक्ट नहीं करते हैं दूसरे के एफर्ट्स को, दूसरे के लिमिटेशन को, कैंसलेशन एंड रीशेड्यूलिंग पॉलिसीज से, बिकॉज it can trigger a lot of insecurities in them. But that is how people learn. That is how we learn from the mistakes that we make. And as therapists, you should stick to the grounds. And also, it will be essential for your team, if you have a team, to have a clear cut communication pattern with the patient, because kabhi kabhi as a therapist you may allow the patient, but aapka team struggle kar raha hai with the patient is being abusive towards your team, and that creates a whole lot of other issues. So if you are a therapist, if you have your own practice, do ensure that you have clarity of communication um, regarding your rescheduling policies, cancellation policies, even before a person goes ahead and books a session with you. And for the people who feel ki as therapists we need to be more empathetic, it is not a problem with our empathy, it is not a problem with our professionalism, it is a problem with the human nature. Sometimes we understand you have your own insecurities and maybe आपको अपनी जिंदगी में boundaries नहीं समझ आई हैं, and that is the reason, one of the reason maybe you are in therapy. So it is for your own benefit that the structure is more professional, more transparent, and less complicated for us to follow, for you, for us to help you, for you to follow it, and also for others also, because आप ये भी समझिए कि आप अकेले नहीं हो. Your therapist has other patients to look after and cater to. because अगर आप ज़बरदस्ती करते हो, आपने अपना स्लॉट अभी के लिए कैंसिल करी है, आगे वाले स्लॉट के लिए आप ज़बरदस्ती करते हो कि लाइक यू गिव मी द स्लॉट, यू गिव मी द स्लॉट, the other patient is making that effort to come and take the sessions and be sure on time. Why would a therapist do that? Why would the therapist make this person who has done everything right and cancel their session to take yours? आप भी नहीं चाहोगे आपके साथ ये हो कि किसी और के वजह से आपको दिक्कत झेलनी पड़े. तो do understand it that your therapist has their limitations, and definitely therapy is a mutually reciprocative process. आप जिस हिसाब से उस थेरेपी के स्पेस को, उस थेरेपिस्ट को ट्रीट करते हो, आपको वापस वही रेस्पॉन्स मिलती है. थेरेपी इज ऑलवेज अ मिरर. How you treat the therapist is how you treat the entire world. How you treat the therapy process is how you treat the entire world and the environment, how you manipulate it. एंड ये दिक्कत होती है कि थेरेपिस्ट हैज़, जो एक अच्छा थेरेपिस्ट होता है वो आपको क्या सही है, क्या गलत है, क्या चीज़ प्रॉब्लमैटिक आई है, बहुत ही क्लियर कट बाउंड्रीज़ के बारे में समझाते हैं, आपको वो चीज़ के बारे में नॉलेज देते हैं, अवेयरनेस देते हैं, जो कि बाहर नहीं मिलता है. एंड दैट इज़ द रीज़न व्हाई वी आर इन थेरेपी, टू लर्न, टू ग्रो, टू बिकम बेटर. सो ट्रीट योर थेरेपिस्ट विद काइंडनेस, बिकॉज they do put in the work, they do want to help you genuinely. And if you are not letting them do that because of your own problematic patterns, do understand there is going to be mistakes, there is going to be up and down, and don't blame it on them that they are not available for you. Don't keep on saying that कि therapist बहुत ही ज़्यादा मनी माइंडेड होते हैं कि वो कैंसलेशन कर रहे हैं या चार्जेस ले रहे हैं रीशेड्यूलिंग के लिए, बिकॉज इट इज़ देयर टाइम. आपका भी समय जाता है कहीं पे. आप अगर कहीं से कुछ खरीद के लाते हो, कुछ खराब होता है, तो आप दोबारा दोबारा 10 बार जाओगे उसको रिटर्न करने के लिए जब तक आपको वो पसंद नहीं आ जाता. तो थेरेपिस्ट का वो एट द एंड ऑफ द डे इट्स अ वर्क, इट्स अ प्रोफेशन, इट्स अ प्रोफेशनल हेल्प. ठीक है, वी कांट मिस यूज इट. इट इज़ द बेस्ट प्लेस टू गेट योर हेल्प. Undoubtedly, no questions asked, no judgments there, but everything has its own limitations. And if you respect that, then you could definitely get the best out of it. This is it from my end. And to the newcomer therapist, don't worry. You would get people who would not understand, who would be problematic. They have their own journeys to in this world to get better. And don't take it personally. It's not on you. It's not on your practice. It's not on your competencies. You are going to meet a lot of people in your life, and it's fine. It's okay. You are here to help, but you have your own limitations. Respect your boundaries, because if you don't respect your boundaries, no one else is going to do it for you. If you like this video, do let me know in the comments below so that we can make more contents like this for psychologists that would like to connect with us to get awareness about how to set up the practice, grow in their life. Do let us know below, and we can make more contents on the field, on problems regarding the field, how to maneuver them, basic understanding of how to get out of that initial ick. And like and share it with your psychology friends so that they also understand and they also know that is fine. It's okay. You don't have to take it personally.